Very good afternoon to everyone. Am I audible? Can you hear me?
Yes, yes, you are audible.
Okay, great. Good afternoon, everyone. I, Dr. Ritik Chawla, welcome you all for this online webinar on acupuncture. You all should feel glad that the knowledge today will be shared by the most senior, dedicated, and the knowledgeable doctor, Dr. Indrajit Singh. Respected sir has an experience of 45 years, and he is the sole founder of acupuncture system in North India. Dr. Indrajit Sir is presently chaired as the director of the oldest acupuncture institution in India, that is Dr. D.N. Kotnis Acupuncture Hospital, situated in Ludhiana, Punjab. Sir has trained enormous students under his guidance. Today he will be sharing his knowledge and experience on acupuncture treatment for sciatica pain. The same presentation was also given at the international platform by Sir held in Beijing last year. I request Dr. Indrajit Sir to please take the charge. Thank you.
Good evening, everyone. This is my introduction. So, my sound is clear.
Yes.
Yes, yes.
Today, my topic is the sciatica pain treatment by the acupuncture. The per the in this presentation we have a contents. First of all, I give the introduction regarding the pain, causes of the back pain, overview of the sciatica nerve and pathogenesis, and connection with the meridians, our channels, and diagnostic technique according to the TCM as well as according modern medicine, and the treatment how we can proceed. And rest we have done little bit research on this topic and it is published in our journal. Next. Next, introduction. Back pain can be defined as a pain of any nature felt in any region ranging from the thoracic spine to the pelvic. And when the pain is confirmed on the lower back, it is called the low back pain. So this is the area where generally pain occurs. Why this back pain is important for everyone? Because one of the most common reasons for seeking medical attention present time, it is 60 to 90% lifetime privilege people are suffering from this problem. 80 to 9%, 90% patients usually have a recurrence episode, but again and again they are suffering from this problem. One of the leading cause of the long-term working is the disability for these problems. Next. This problem is not we are suffering in India. It is epidemic problems. In whole of the world, they are the sufferer of the back problems. Almost any structure in the back can cause pain, including any ligament breaking, joints problem, muscular, vessels, and nerve-related problem. Pain can be occur. Generally, intervertebral disc and joints problem, most are the commonly affected to this problem. Most of the pain do not have any clear. Sometimes it is not clear what are the reason of the pain. Multiple study has shown recurrence within a 3 months to 6 months or 12 months of these problems. Next. Next. And men and women are equally affected. We can't differentiate that men are generally suffer or women are. Is both are the equally affected from this problem. Generally, is the pain is occur in the age of 30 to up to 50 years. The WHO report, according to the WHO report, in the year 2010, global burden of the diseases study estimated that low back pain is among of the top of the 10 diseases, and it is injury the account is the highest number of the daily disability adjustment of a life year. Worldwide, it is recorded. General causes. There are multiple causes for the back pain. Generally, it is attributed to the nerve root compression, nerve inflammation. Third is the degenerative bony changes, deformity of the bones, and trauma, injury. These are the four major causes for the problems. And specific example we can say some muscle spasm or muscle strains, prolapse of intervertebral disc, at any cause of the osteoarthritis, spinal spondylitis, and ankylosing spondylitis is the main name of the diseases of the back pain. Next, rheumatoid arthritis, rheumatic disorder, skull, rapid pain, and poor posture. And in the case of women, pregnancy is the main specific example for the pain's reason. Next, sciatica or prolapsed intervertebral disc is one of the most common cause for the low back pain. Now everybody we know the overview of the cyclic nerve. Cyclic nerve is starting from the lumbar four vertebra up to the sacral third is the joint and the clefts of nerves. Then from the pelvic is going downward as a main known as a cyclic nerve up to the popliteal fossa. After the cyclic nerve is the largest nerve in our body. It is big, flat, it is originating from the lumbosacral plexus from lumbar four to sacral third vertebra. It ends just above the superior angle of the popliteal fossa by dividing into two nerves. And that one is the tibial branch and the camal peroneal nerves. These are the root of the cyclic nerve from the pelvic up to the popliteal fossa. Next. Sciatica is a syndrome involving the nerve root and inflammation that progressive enough to the cause of a neurological symptom in the area supplied by the affected nerve root. That is one of the causes of the disc prolapse. Other is the pinching of nerve of the pain. That is the cause of the sciatica syndrome. Next. Next. Sciatica is the most frequent radicular pain syndrome of the spinal origin. Occurrence due to the irritation of the spinal nerve root, usually associated with the disc prolapse. Most of the common involvement sites, generally L4, L5, and lumbar 5 and sacral 1 nerve is affected. Next. Generally, pain is due to stagnation or deficiency of Qi in our meridians. Those and general pathogenesis for this problem, stagnation of heat and stagnation of blood around the lumbar region. Second reason is overindulgence in the sexual activity. Third reason, according to the TCM, according to our science, deficiency of kidney yin or deficiency of kidney yang. So the lumbar region is short of the yin, nourishment and young warming sport is lacked. Sciatica belonging to our category low back pain as per the traditional Chinese medicine, it believed under the category of the B syndrome, painless syndrome. Having the typical symptom like pain along the lower back and outside of the leg involving the meridian urine bladder and gallbladder root where its pain goes. This connection with the meridians in the back side, neck, next. And this is the connection with the bladder meridian, root meridian chart, inner canthus, then it runs head to the toe along the neck. So both meridians are involved in this way. Next. Gallbladder meridian, we know it start from the outer canthus and going toward the skull, coral region and shoulder, and then follow the left side of the and then lower extremity up to the toes. Generally, these two roots are suffering from the pain of the patient. Next. Another few meridians may be affected during the sciatic nerve problems or lumbar problems. That is next main meridian is the foot organ. It runs through the vertebral column. From it enter into the kidney and along the waist to where the kidney is coming. Because when it goes downward in the lumbar region, it connects with the kidney. That is maybe when the effective area lumbar 4 and 5 will be entangled at the nerve or disc prolapse, then kidney is maybe affected due to the this region. Next. Next, our two extra meridians may be involved. That is the governing vessels that do my channel. It runs on the posterior midline of the body through the inside of the spinal column. Anterior side of the column, जो हमारी ये है, do my meridian is governing. Next is the affected meridian is dimi. Dimi is our belt channel, belt meridian. It runs transversely around the wrist. That was the reason it also known as the belt channel. When the pain has problem in the lumbar region, sometimes patient are complaining us, we have a heaviness on the waist side. Next. The clinical signs. The nerve pain may be very soft and like a shooting pain, like electric shock pain, and radiation toward the leg up to the foot. And sometimes some patients are complaining with the burning sensation, tingling, or some numbness. How much the nerve is involved, that was the symptom are different with the cause of the factors. Next. Traditional medicine diet. Now we have a diagnosis according to the TCM. TCM, first of all, sometimes patients are not able to explain where is the problem, where is the pain, what kind of the symptom, where is it occur. So how it occur. So we have some techniques to diagnose itself. According to some, we just diagnose the pulse, where is the stagnation and which meridian is affected and what are the region that is working under the hyperactivity or the low blow, deficiency or hyperactivity. Then we have diagnosed according to the pulse. Next. Second, we have technique how we diagnose. We have a pain due to the dampness region. If the pain is the cause of the dampness or cold nature, then the pain in the wet it aggravated in the cold season or aggravated during the rainy season or when its winds occur, then it's the problem aggravated. On the examination, we can see the tongue. Tongue is pale and white and slippery coated and pulse is very slow and taut. Strong pulse and very slow. Next. Causes of this. The जो पेन का रीजन है, it may be blood. That is the tricking of fixed pain. When if the patient is complaining for the fixed pain in the lumbar region or waist area, it means physical. Take the physical history. Might be any injury in the young age. That may be one of the causes of the collection of the blood in the lumbar region. That that indication you can see on the tongue as a purple dark spots on the tongue. That shows indication as stagnation of blood in the lumbar area. And the pulse is unsmooth. That is not clear and unsmooth. Next, if the kidney is involved in this problem, then there may be dull and sore pain developing very slowly and could be relieved by the pressure and aggravated by the little bit physical pain or this condition and disbelief. Well, this connection is there. And the body coldness feeling. Next. Along the kidney and domino. If the problem related with the kidney meridian or domino, then the pain occurs right in the middle of the lumbar region. It may be center of the spinal column and pathway is account follow with the kidney meridians, particularly overlapping with the Dumai channel. And next, if the pain in the waist, the belt region, and it involved with the bladder also, the belt meridian is kind of pain where the patient feel like waist being bringing and down somewhat heaviness. A person is not able to define it. The problem is only back or lower or where it because the feeling on the waist is just a tightness in the waist region. The bladder meridian and pain occur in the both sides of the lumbar region. So we can't differentiate which side is the pain. The patient can express no. Sometimes we feel pain on the left, sometimes the patient feel on the left, or sometimes they say no, both sides I have a problem. Next. According to the TCM diagnosis, you know, we have a two region. We are not giving any name according to them. We have only that is the disbalance of our energy, yang or yin. If it is imbalance, that is the cause of pain. Next. And next, we have a clinical diagnosis according to the modern medicine. Next. State leg raising test. It will be positive. If the patient ask the patient lie down on the spine position, the examiner little bit lift the leg gradually up to the knee kept straight. The stretch of the leg, if the pain started from the 30° to 70°, it means nerves come in somewhere entangled with the, or it may be due to the prolapse of intervertebral disc, and the patient will be complaint of pain up to which angle we have to know. We can assess how much this prolapse, how much nerve is entangled. Next, kindly I say everybody please mute your phone. People will not disturb to listen properly.
Everyone, please mute your microphone. There is so much of disturbance.
Confirm what if we are diagnosing according to manual side. It may be we can see on the radio column, X-ray routine में checkup में we can observe it. It can be show loss of lumbar stenosis. The lumbar का जो है थोड़ा posture में deformity आती है. Or it may be show in the intervertebral disc space narrow, reduce of the intervertebral space. Next. And other thing, in the this is the in the X-ray and MRI difference. In the MRI, we can see the disc prolapse is how much it's this how much soft tissue are involved in the nerve. We can say we can only diagnose according to the MRI. Next. Generally, patient has a complaint in the lumbar region, a nerve involved lumbar 4 vertebra and lumbar 5 vertebra are sacral one. These are the three vertebrae are involved during the cyclic pain. Next. Now the question, primary treatment. If our diagnosis is confirmed according to our system, if the diagnosis is confirmed with the modern medicine, then we have say what kind of treatment we can provide. According to our science, we have a choice of acupuncture. That was the primary treatment. Primary हमारा होता है, how we can proceed it. First, our aim to relieve the patient by promoting the chi and blood circulation to the local area where is the stagnation, and that with the help of the primary points, including the RC tendon points, are the points related with the two meridians or unibladder meridians. That is the main point, primary stage, because the patient want immediately relief. That is only possible if we treat through the help of the tendon points or Dumai meridian and Yumi meridian. That will be immediately patient will little bit relief by the pains. Next. Then the second step for the primary treatment, that was the primary point. After the RC points, if the patient feels better, then we can add the Sensu point UB23 that is related with the kidney, and the Samsu UB25 that is related with the bladder, and Wai Chung is the point on the back of the popliteal portion, back of the knee, popliteal in the center of the up to this area we have in the cyclic nerve root. Then if the patients have an acute skin, if we are not able to treat these points with them because the patient has a too much pain on the left, unable to take lie down on the firm position or uncomfortable, then we use some distal point for the acute purpose. That is the Hoxie. Hoxie is small intestine, 3 point. Here we just flip the hands, and here is the point where we insert it. The needle need it from 1 inch to half inch. 1.5 inch need to insert it and manipulate slowly, pull and down. After every 5 minutes, we can manipulate 2-3 times. So immediately acute pain in the lumbar will be relieved. And other point we can use in the first, here is the reason on the hand there are 2 points we can use to reduce the strain or reduce the spasm on the lumbar region. That is the extra point of the lumbar stem. That is the hand point on the dorsal side of the foot. As the lumbar go means pain starts from the back and goes downward due to the region of the cold dampness, due to the cold dampness, and any deficiency of kidney patterns. If we have a symptom of that related, then we can add moxibustion with the warming needle moxibustion. On the top of the needle, we can take the moxacone and burn it for the providing the heat to the kidney area and lumbar area. Next. The treatment, we have a two-way. If the dampness is there, then we have a governing vessel 3 points, governing point 4 points should be with the warming needle. Only 2 needles. If the pain is due to the lumbar cold region or dampness region or dampness cause are in this, then we have only 2 points where we can use the warming acupuncture points needle, that is governing muscle 3 and governing point 4. And next, if the collection of the blood in the lumbar skin, then we have a point gallbladder 17, gallbladder 17 and bladder 32 should be needed bloodletting method be applied. But needling, bloodletting method must be applied with the full sterilization technique. Sterilization of the skin needed, sterilization of your hand, gloves, it can be applied. Then little blood you can squeeze from these 2 points, so we can reduce the blood stresses on the lumbar region. Next. Next, if the region is related with the kidney deficiency, then kidney deficiency, it may be due to the point we can reduce urine bladder 23 sensu and distal point kidney 13 as a taxi point and bladder 52 points. There are only 3 points can be helpful for this. But anyhow, in case of deficiency of yin in the kidney, then we apply the reinforcing method, because a majority of the people does not know how to reinforce the energy, how we can reduce the energy. So technique of any region of the pain is different. Manipulation method is little bit different. So in case of the kidney zinc deficiency, then we treat through the point of UB23 and kidney 13 and UB52 bladder 52 points. With the needle is reinforcing method of the energy, especially if the deficiency of the yang, if the deficiency of the yang in the kidney, then we have add UB23 P governing vessel point 4 Migman in the lumbar 4, number 5 in the center for the kidney yang deficiency. And these points can be used with the warming of needle and moxibustion can be applied and reduce the deficiency of kidney. Next. Now, the main topic, if the patient pain in the young female or male, Maybe due to the overindulgence in the sexual activity. Then we have a single point needle. I have tried many young youngsters. That little bit point is very danger area. That is the UB1 is Jingming point, just inner canthus. So be conscious. Those who have a full skill of the insertion of needle, they are only used with the single needle, single point. It pain will be gone immediately. Immediately. If you are not able to treat with the UV1, you can use the point UV4, UV5 toward the upward direction. So easy because the eye area is a little bit danger. Those who are not able, then you can use UV4, UV5. Little bit you get the result later on, but UV1 is very effective. Those the reason of the back pain is the overindulgence in the sexual activity, especially in the young couples. Next. Now we have a treatment when little bit is control the pains, all the symptom is controlled, patient is able to work. Now we go for the a systematic treatment. That is the meridian. First, we divided treatment in three categories. First is the acute stage, second is little bit relief. Now in the third stage, we give the long-lasting relief because according to acupuncture science, I claim acupuncture give the long-lasting or the permanent relief. That is only possible if you treat systematically also with the acupuncture. Now we have a systematically that is the base of our meridian theory that we are points we can select if we know the disease region is the kidney or to my channel, then we have a little bit use some distal point and local point also. That is the Hoxie, small intestine 3, extra 7, and the next point, distal point, if the bladder is involved with the kidney, then Kullum UB60 and bladder 63 are XC K13. That we can be used UB60 and 63 alternately we can use. Next. And we have a little bit. Some points we have a key points. Key points we have a reserve points. Where if the result is not, if the result is almost recovered from the back pain and leg, then last what patient complain, they say we have a heaviness in the foot, pain in the dullness feeling in the foot. Then we have some key points. Last points जो कहते हैं हम लोग ये हम इस्तेमाल करके उसका हम लोकल एरिया पे भी हम क्योर कर सकते हैं. That is the UB58, UB60, 62, 63, 66, 67. But only from these 6 points, we at the one time we use only 2 sets of the needle. If we use the bladder 58, then we use the bladder 67. Then little another one sitting we use only 2 points out of these 6. Next. If the disease is related with the gallbladder meridian, so now is our area. We select these 4 points for the if the pain region is the gallbladder, root is the pain of the gallbladder. Then we select these 4 points and again we request you GB34, GB37, GB39. So in one sitting we only select 2 points. The first is GB34 if we select, then we add GB41. In case if we select GB37, GB39, then we combine as a second course. Why this is thing? Because if the person is feeling dullness or heaviness in the gallbladder area, then we add the GB30 and GB40. If the person is only have a pain, numbness or in the root of the lower extremity, then we select gallbladder 37 and gallbladder 39. Next. Now, these are the general acupoints we can say sciatic. These only 2 points we can use 2 points when the everything will be normal. pain is reduced only feeling, because patient is only coming for the acupuncture treatment after trying the other medicine. Then they are visiting acupuncture clinic. So after that, sometimes patient is feeling the weakness in the leg. If we just compare with the both leg, might be some side, one leg is weak, there is the pain. So we had these points for the just check the weakness of the lower extremity. Next, the efficiency of using acupuncture and moxibustion for the pain is closely related with the treatment causes and our pattern. We have a 8 extra principle of diagnosis. So must be, because sometimes say patient हमने तो 15 दिन ट्रीटमेंट दिया था जी, उसके बाद ठीक हो गया, then again pain starts. Because if we are not correctly diagnosed, then say according to the 8 principle, then the patient does not get the permanent relief. If we have a problem of a disc collapse, acupuncture can only reduce the rest. We can add little bit correction. We can add little bit massage. We can add the physiotherapy. We can add the cupping system also, but according to the condition, how much disc collapse is there. Because mechanically, little bit we need the help with the physiotherapy, massage and correction to set up the disc collapse of the disc. Next, importance. Next should be given treatment of primary. So what previously we say, we must be categorized. First stage, second stage, and the third stage is the recovery phase. When the patient is almost recovered, then we try these all the things. Next. Now, acupuncture has proved moxibustion helps to relieve the pain immediately, and the disc collapse or fiber rings cannot be completed sometimes. So we must be settle of the disc, must be take the little bit help from the other therapy. That is physiotherapy. We can say that light be if the need the correction is too much needed the disc process, then we can give the correction and tuna massage. Not massage as general on the lumbar region. This tuna massage is the acupuncture massage, that is the specific, because the people does not know the tuna. Tuna जैसे ये acupressure है, because not acu. Tuna is the different technique of massage. We just give the relaxation of the nerve where is the entangle. So that is tuna is little bit different. Those who do not know the tuna, they can check, see and learn from the YouTube, because few tuna massager physician has put in the YouTube how to apply the tuna massage. Next, these are the methods. So the upper picture shows how to do the tuna massage, how to rotate it, either clockwise or anti-clockwise. It depends on the condition of the patient. Second, if little bit relaxed, then we have take the help of yoga of the physiotherapy side, how do the exercise. Next, these help to given the strengthening to our muscles. So next time will be not easily this collapse of the muscle, because the pain we can control with the acupuncture. We can set up with the physiological, with the setting of the disc. But if the muscle is not fully strengthened on the lumbar region, then pain reoccurs. So the third stage is to giving the strengthen to the muscle of lumbar region. That is the with the tuna massage or little bit physiotherapy and moxa, patient can help it. Next one. The last 10-15 years, I have done, we compiled our research, and I am thankful to Agroha Medical College, where my daughter, youngest daughter, Dr. Neha is doing MD. Then with the combination of the doctors, with the help of their Agroha Medical College, we have compiled the system and we have compiled the treatment and how we do the research, and it is good news for everyone because our institution has first got the opportunity publish our this article in International Journal Index. Is invited guest speaker in the International Acupuncture Seminar at Beijing last year. And there I have given little bit some live demonstration also in the future. Next, I will show you in the slides. Next. The published journal index. The first journal from India side, it is purely on acupuncture theory. It was published 2 years ago. So it is good news. It is very helpful for us to get the independence recognition from our country. So next, these are the whole journal is published. Thank you very much for listening me patiently and hope so you must be apply. If you have any difficulty, you we can always ready to give. I will show one video of my patient. She is sport champion. So you can say how much he recovered and how he recovered. Neha, next video. Voice. Voice. नेहा वॉइस नहीं है बेटे. He is national champion and during the sports has a back skin and then the pain after try with the modern medicine, then pain aggravated and towards supply to the legs. Then she started come to our clinic hospital and she got the relief very soon.
मेन तो आई अब पूछना पापा से.
अब आई, अब स्टार्ट हुई थी, दोबारा करो. बीच में आई थी, अब फिर बंद हो गई. नेहा नहीं क्लियर बेटे. नहीं है तो उनको बोल देते कोई बात नहीं. हाँ? क्या नहीं हाँ? क्या? हेलो.
Thank you, sir. It was indeed a great and a knowledgeable presentation. Anyone has any queries, he or she can raise his hand and we will unmute you and you can ask your questions.
I think some problem in the video. So if you want not listening properly, then you can go our YouTube channel with my name. You can see and you can listen. There are so many video on the back.
If anyone has a question, please raise your hand. We will unmute you and then you can ask it directly from the sir. Sir, Madam Neeta Thukral is having a question from you.
Okay.
नमस्ते सर, मैं 3 साल पहले मैंने आपसे बेसिक कोर्स किया था। यहाँ दिल्ली में आप आए थे, शायद आपको याद होगा। यहाँ पे इन्होंने बुलाया था, पंकज गुप्ता जी ने और संजय अनेजा जी ने बुलाया था आपको। हेलो।
हाँ जी जी बोलिए।
हेलो।
हाँ जी सर, मैं एक्यूपंक्चर सीख रही हूँ, महाराष्ट्र का कोर्स कर रही हूँ आजकल, तो इसका एग्जाम भी देने वाली हूँ। तो बड़ा अच्छा लग रहा है सीखने में। वैसे मैंने 3 साल का इनका इलाहाबाद का कोर्स किया है, 6 सेमेस्टर्स किए हैं। बेसिक टीसीएम तो पढ़ा है, तो बाकी सर हम और नॉलेज चाहते हैं आपसे और क्लासेस चाहते हैं। बड़ा अच्छा लगा आपकी क्लास से।
मैडम जो आपने दिल्ली में बोला जो हमने रिफ्रेशर कोर्स किया था 5 दिन का।
हाँ जी हाँ, याद है। हाँ जी,
That's just introductory for the science, right?
हाँ जी।
इसमें कहाँ किसको प्रॉब्लम आ रही है? Basically, we are not criticized to anyone because due to the shortage of time, due to the government problems, and the most of our teachers and most of our colleagues just providing the few days courses, so that is not enough. So, and here in Punjab, previously, in 1995, we have started 3.5 year diploma courses.
Okay.
Right? On the same pattern, the West Bengal government recognized in 1996. Then the same courses were adopted with it because that diploma is framed by the China Academy of Education. And due to the 2009 notification by the central government, and we have stopped that the diploma courses. Now we have only 3 months course. That is the basic. So basic means you must know how to hold the needle, how to insert the needle, how we can use the TCM pattern. That we even knows because one should know the basic thing of the acupuncture as a classically. The majority has some are just do acupuncture, some are doing the cupping method, some are applying with the acupressure. The majority does not know the classic acupuncture. Because you are the candidate for the registration in the Maharashtra, so you must be. We have tried to frame all the question paper, so everybody will succeed and success their examination. But you must be, if you want to be good acupuncturist, you must be learn classic acupuncture. In Ludhiana, we have a 3-month daily regular courses, not online, because due to the COVID time, we have few of the students have just completed 3 months. They are with us. So when you learn 3 months regular, then you understand 3 months is not enough time to learn it.
ओके सर, आई विल ट्राई। मैंने किसी को भेजा भी था सर आपके पास, संदीप जी हैं चंडीगढ़ से।
Yeah. So
हाँ जी.
he is also with this program.
Yeah, I have seen, sir.
You can share how much he learned within the 3 months.
Yeah.
So for the clearance of the test from Maharashtra, if the COVID will be not over, then we are planning little bit people will be get the clear of the exam. We are trying every Saturday or Sunday one web class for the general knowledge of acupuncture.
Thank you, sir. Very beneficial. It will be very beneficial, sir.
Thank you.
Thank you, sir.
Sir, there is one question from Madam Shweta Shah that in your explanation you have said GB17 while it was written BL17 on the slide. So which point is to be used?
Yeah. Again, can you repeat?
You have said the point is GB17, but on the slide it was written BL17.
Oh, in English, Blagger 17. Yeah. Might be, some books are if we just write the number, may be different because in my practice, I am generally using the name of acupuncture points. So for just general knowledge for the all, we are just checking the number. It may be varies because the UK has, but if we use the pattern of WHO, then is the correct number. Next one.
Now I call upon Dr. Ritik Chawla, please.
Thank you, sir. It was indeed a great and knowledgeable presentation. And I would like to invite Dr. Rajesh Bhayana to conclude this webinar and give thanksgiving to Dr. Indrajit, sir. Thank you, sir.
Thank you.
Hello.
Carry on.
Hello. Yes, good evening to all. Dear friends, all of you heard the lecture on important topic from Hindustan most senior consultant. We all thank you for that. Dear friends, today you got information about acupuncture related to sciatica. I can understand that it would have been very beneficial for all of you. You all listen attentively, and further such programs should continue to go on like this. I also want to share a little bit of my experience with you for 2 minutes. For my experience, UB36, UB37 and UB40, if given acupuncture points in the manner, patient get more than 50% result in the single sitting. Many thanks to the team, Dr. Inderjit Singh Dhingra, and thank you all of you loving heard this picture of today seminar. Further keep doing such programs again and again. I am deeply grateful to all for this. Thank you very much, Dr. Inderjit Singh and his team.
Thank you, Rajesh. Rajesh is my 35 years ago student. He has learned acupuncture from me before 35 years and be proud he is the very much a good practitioner in the Delhi. Thank you, Rajesh.
Thank you.
Somebody has sent the question, can we puncture the GB34 for the bleeding? No, that's not. We create the weakness in the lower extremity, below the knee. That is not true. You can only do the bloodletting point used in the lumbar regions, not in the. After the bloodletting, you must do the moksha box, put on the moksha box for 10 to 15 minutes. Anything, anybody want to be? Any question?
All the participants, please switch on your videos to click the photograph. All the participants, please switch on your videos to click the photograph. Thank you.
Sir, what do you say that taking point and pain only on GV30?
Okay. One question is raised by somebody else कि जीबी 30 bloodletting कर सकते हैं या नहीं? If you do the bloodletting in the neck area, जीबी 30, then it will be create the partition. Is the shaking of the neck may be occur. So please don't use the bloodletting on the area where is the little bit danger, because this is very close to our midbrain. That is the reason before bloodletting you must be aware about the location of anatomically. Where is the point? So it will be help. Try to be, say, give the best benefit, not worst, if any reason. If you are confirmed, if you are master, if you know the things, then you do on the accurate point, not with the these critical points area you do the bloodletting. Thank you very much for everyone joining us. I request I am trying for the next again one class might be with the related with the dental problems, and we request everyone you must be send your name and city and phone number to Dr. Neha or Dr. Sandeep or Dr. Rajesh, so we can be next time we will send you the link. Thank you.
Dear participants, you all would be glad to know today Dr. Tilak Kalra has joined our webinar from Australia. So please a big round of applause for Dr. Tilak Kalra. He is a very senior acupuncturist practicing in Australia, and I am raising a request from all of your side that the next webinar would be taken up by Dr. Tilak Kalra, sharing his experience with all of you. So, sir, we hope that you will share your experience with us. So, you can mute your microphone.
Dr. Tilak.
Yes.
It's done.
Couple of points here which you raised. I noticed that you haven't mentioned about GRG points in the area where the problem is.
Sir, it depends on the location of the pain.
Oh, I understand that, but that's what we're talking about.
Yeah.
There had been an international conference some time ago, and from my own experience, I have noticed you get excellent results from that. Now, you talked about diagnosis from pulse and tongue. I find the most important symptom simply when people come in, I can tell where the problem is. How? If a person can't sit, invariably is a disc problem. Okay? And if a person, after when he gets up, he's got a pain standing. If he walks, it's a hip problem. But general walking can be hamstring. This is how I differentiate.
Doctor,
So you don't need even MRI. From my hand, I can tell. When I was in Ludhiana, I did that to one of the patients who came in. What was the problem?
Yeah, of course you are right, Dr. Tilak. Is the reason the TCM we just diagnose according to the TCM, just check the pulse and tongue, because we want to be diagnosed where is the hyperactivity of the which channel and which meridians. That is the hyperactivity or the hypo, the deficiency. So we just take the idea. Say we have categorized the three forms. One is the acute stage. Second, if we just very first stage, we just treat the only our aim to reduce the pain of the patient.
Sure.
But
No, it was an excellent
that time,
presentation.
there are
I
more
just wanted to add these two
the
points.
first sitting is the most appropriate time to give the analysis of where is starting the disease, because the patient is coming to us when the complex of disease, complex of system. Even sometimes patient is only say, we have acute pain, is shooting pain, I am can't able to sit, I am can't able to walk, but the real internal changes can be only reflect on the tongue or pulse.
Sure.
That is our according to TCM. So this is helping give the long lasting relief. I know you are very much related with the pain management. So Neha has requested you. I also request you. If it is convenient to you, the next we can give a web seminar from your side, management of the pain, how patient can be managed.
Let me look at my time schedule and then I'll let you know.
Okay. Because main is purpose of the TCM pulse and diagnose to analyze where is the blockage, where is the hyperactivity, where is the stagnation. Either it is the blood or the chi state. That will only reflect in the acute stage. If the little bit patient relief after the treatment, then the symptom will be automatically reduced, diminished. So it's not able to analyze the symptoms.
But don't forget there are 28 different qualities of pulses. And unless you sit with a master, it's very, very difficult. And you have to spend months with a master to really feel what is plus and what is minus.
That's how in India there is little bit situation is different. So we are being a founder of the acupuncture system in India, we are trying our best to enhance the knowledge of our other colleagues, those who are doing the practice in the different part of the country. So we are our aim. So same, we are getting the help from the international faculties also. So and like you expert, we must be take your help to enhance the Indian acupuncturist knowledge. So it is a need of time for us to enhance the knowledge. That is only possible if we share our knowledge to others.
Definitely.
Because the 1 hour is not sufficient to explain the whole back problems. There are so many visions. I saw the two slides. I asked Maniga. In China, when I present this paper, you will surprise her. In the whole house had just requested to the organizer, please ask Dr. Singh, can they demonstrate live on the UB1? Because the majority of the Chinese and international faculty, they are sitting there. And few of them are my teacher.
Yes.
I learned in 1984 from them. They say, when we enter here, that sometimes bleeding come in. How you diagnose, how you select the point, the technique, and it is, and very much happy to say, and after the successful insertion on the both side of the eye, and the one China Academy Vice Chancellor has congratulated me, and they have selected me for the international faculty. Every time they say, okay, we will invite you to share. They say, sir, where you have learned in China acupuncture? Because you have so much master, and it means acupuncture is more popular than the China science. Yes. This was from the China Vice Chancellor University. And you can say, okay, we are feeling proud. But even then, we know we have a little knowledge. Basically, we are the student of Dr. Basu. Primarily, we have done acupuncture. That time, we have not much know about the traditional mode of diagnosis. With the experience, I got the privilege to learn the acupuncture, USA, UK, Japan, and China also. So it is. So now I am trying. Okay, we must be share our knowledge to everyone.
Sure.
Thank you, sir. It was indeed a knowledgeable presentation. Thank you for sharing your valuable knowledge. Thank you, Dr. Tilak, and I thank you all the participants for joining us. And I request all the participants to send their email IDs, contact numbers, and their names. So we'll be able to send you the recording of the webinar. And I hope we meet next time with webinars on different topics. Thank you everyone for coming. Thank you.
Thank you very much.
Thank you. Thank you.
Thank you.